Hello everyone. Let's start with a quick question. Do you know someone that used drugs too much? I did, and honestly, it was heartbreaking. Not because of his use, but because of how ineffective the system was in getting him better. Months of rehab, multiple relapses, trying psychotherapy, we just never knew what would work. And he's not alone. There's 200,000 people like that in the UK alone. And you probably all know someone like that, we just never talk about it. 35 million people globally suffer from substance use disorders. They go through 4 to 5 cycles of rehab, 40% of them relapse, 1.5% of them overdose. And it all costs a lot of money. But it doesn't have to be like that. What if we try to make the system a bit more proactive, a bit more data-driven? What if we try to make addictions predictable? Ladies and gentlemen, I'm Michał, and I'm the founder and CEO of Subreal, a company building monitoring tools for addictions. Our core product is Subreal Care, an investigational software as a medical device for opioid, alcohol, and benzodiazepine use. It collects neurological, psychological, and physiological data using video footage and psychometrics, and based on that builds risk assessments. Those risk assessments help clinical teams predict relapse, predict overdoses, and provide treatment to patients who need it most. And what's the benefit? At least a 15% reduction in relapse rates that can generate up to £80,000 of saving per relapse saved. And the market is huge. In the US alone, $35 billion is spent on inpatient, outpatient, and medicine-assisted treatment. And we are already tapping into that. We are currently working with 4 universities and 2 NHS clinics to get our product validated and regulated. We have 10 more LOIs for clinical work and are currently running 4 research projects, with 1 already funded and published by Innovate UK. We are also supported by the best entrepreneurial networks out there, including Ivor and Sigma Squared, and we have scientists from World Psychiatric Association or European Drug Agency. And did I forget to mention, we are currently awaiting a 1.3 million governmental contract with the Office of Life Sciences to be announced in August. Hence, as you can see, we, or more precisely me, are at capacity. So we're currently raising 1.7 million in today's money to expand the team and build the capacity to fulfill those LOIs and fulfill those contracts. Thank you very much, and I am looking for someone to help me make addictions predictable.
Wonderful. Well, very good. Thank you so much. Great. We'll go to Kirsten from Octopus for your question or comments.
Great, thank you for that presentation. Really meaningful business that you're building. In terms of this funding round, raising 1.7 million, what milestones does that help you unlock from a commercial standpoint?
That would allow us to get our product fully regulated with both EU MDR, FDA, and UK MHRA, which basically would fund clinical trials, but it would also expand our product dataset. So currently we are developing Subreal Care, but that is the data gathering tool that then will drive Subreal General, a foundation model that is generalizable to other addictions, other substances, and comorbidities, which is much more generalizable. And on top of that, Addiction Bench, our own internal addiction benchmark similar to Health Bench from OpenAI.
Great, thank you.
All right, wonderful. Very well done.